Next is Dhwani Bhadresa. She is entering her fourth year of a Bachelors of Kinesiology with a minor in Sociology at McMaster University. She is passionate about serving the community. She's held leadership positions in the McMaster Indian Association and is the co-founder of the Paediatric Mental Health Initiative. Her interest and research is focused on analyzing mental health within the South Asian community in order to facilitate tangible change. Here she is on the prevalence and adverse effects of mental illness, depression and anxiety with Canadian South Asian immigrants and children of immigrants.
Thank you so much for the introduction. I wanted to start off with saying that I started this research article with Sharpen the Quill in the winter semester, and I was able to work with it with a lot of people, and I was able to find a lot of interesting information. So to start with, my research focuses on two specific topics. We're going to start with the mental illness of depression and anxiety, and we're looking at prevalence rates within the South Asian community. So in particular, I wanted to start off with some demographics about the South Asian community and how many there are. So in Canada today, we have upwards of 2 million people in Canada, and it basically is the largest visible minority groups. And this comprises approximately of 5.6% of the total population. And here is a map of the South Asia, and here are listed a couple of the countries that are comprised within there. So this includes Nepal, India, Bhutan, Pakistan, and a couple others listed. And so my research focuses on analyzing South Asian immigrants and immigrant youth and the respective impact on their mental health. And so there are a couple key terms we need to understand to be able to understand my research. So in particular, immigration. Immigration is the process of moving from a South Asian country to permanently living in Canada. And children of South Asian immigrants is classified and identified as adolescents with parents born in South Asia, which includes the countries I mentioned before, like Nepal, India, Bhutan, and etc. Prevalence is a really key component here. Prevalence is the number of individuals who are diagnosed with a specific condition in a specific population. So this means looking at mental illness statistics in terms of depression and anxiety. For mental illness within the South Asian community, there are a couple contributing factors that keep repeating. So for example, language barriers, socioeconomic, and cultural barriers. I really wanted to take a moment to define what mental illness really is. So mental illness involves 3 specific alterations in one's respective health. And so this means one's emotions, behaviors, and the way that they are thinking changes. And this inherently impacts the way of their functional capabilities. In Canada today, upwards of 20% at any given time are clinically diagnosed with a mental illness. And this increases the demand for mental health research. And again, I wanted to emphasize this paper really focuses on examining the gap in literature of South Asian Canadian immigrants and their children and the prevalence of depression and anxiety using both qualitative and statistical analyses. So in particular, what mental illnesses am I looking at? I'm looking at GAD and MDD. Generalized anxiety disorder is characterized as persistent, excessive worrying about a number of different things that could relate to one's work, family, and health. In particular, symptoms could approximately look like persistent worrying, anxiety, overthinking, and perceiving situations as if they were threatening. Some physical symptoms could be looking at fatigue, trouble sleeping, easily irritated, sweating, nausea, and a couple others. And in terms of major depressive disorder, MDD, it's characterized as one depressive incident which can last or persist for up to 2 weeks. And the common symptoms tend to include loss of interest in general activities, feeling consistently sad, and having a depressed mood. So the purpose of my investigation here is to be able to determine the prevalence of MDD and GAD within the South Asian community. And so this means the independent variable here is the Canadian South Asian immigrants and their children, so children of immigrants. And my dependent variable is the prevalence of GAD and MDD. And I wanted to just point out here, it's associated stressors for mental health conditions. So this will come in with my qualitative data. Additionally, I needed to have statistical significance when looking at data. So p less than or equal to 0.05 was all the stats that I was looking at. Additionally, another common statistical method is odds ratio, and that determines associations and correlations between exposure and outcome measures. So this will be in relation to MDD and GAD, and odds ratio greater than 1 is exactly what I'm looking for. So what did I find? In terms of quantitative results, there are two sectors. I'm looking at COVID-19 and there were immigration aspects. So in terms of the pandemic, we're looking at decreased levels of mental health outcomes for visible minorities in comparison to white participants. And this data was provided by Stats Canada, so I really want to emphasize here that these aren't statistically significant data. A higher chance was that mental health outcomes were due to two areas. This was that the reporting of the symptoms being associated with GAD, and a higher percentage are reporting poor self-rated mental health status. In terms of statistics, this comes out to GAD being associated with higher for visible minorities by around 30%, and for white participants, approximately 24%. So a gap around 6% we're looking. In terms of migration, studies conducted was able to determine that South Asian immigrants have greater odds for an anxiety disorder, and this correlates to two specific factors. We're looking at the age of immigration is approximately equal to 17 or less than 17 years of age, and the self-rated mental health status range between fair to poor. In terms of mood disorders, South Asian immigrants have a prevalence of 3.49% and anxiety disorders of 3.4%. And Canadian-born South Asians' prevalence rate of mood disorders is 3.48 and 1.09 for anxiety disorders. So this is really indicative of how Asian immigrants' prevalence rates are higher than Canadian-born South Asians. I just really wanted to take a second here to understand the gender differences of South Asian immigrants between female to male. There's an increased risk for South Asian female immigrants who experience migration at a young age, so 17 years of age or younger, and who correlated in other factors such as participating in smoking, food insecurity, and had a self-rated health status of fair to poor, with a heightened risk of mood disorders. So again, this isn't just particularly to the South Asian population, but this is the impact of immigration on migrants. So what we're looking here on is that children who have immigrated at a really young age, so between the ages of 0 to 5, illustrate a higher increase in the prevalence of mood disorders. So here it can be said that immigration has a significant impact on mental illness. So here is qualitative analysis. And in this qualitative analysis, I found a study that looked at associated stressors of mental health condition in relation to the South Asian immigrants and Canadian-born South Asians. So the sample demographics of the study was broken down into 7 immigrants and 3 participants born in Canada. And particularly this comprised of South Asian youth. And so I wanted to talk a little bit about common factors between all these topics right here. So this starts off with the stigmatization of mental health is a common correlate. And this means that it impacts the support system within the family. And in addition, there's a common parental conflicts that tend to be a large factor at play here. And this comes down to the differentiation between two worlds amalgamating of the South Asian culture and the Westernized culture. And it was stated that youth felt that they were embodying a dual identity at times. And another common correlate is that stressors are commonly found in academics. There's a high pressure to succeed academically at a young age. In addition, there's a lack of healthy role modeling. So healthy role modeling is really important to be able to facilitate good behavior. So a lack of it made participants feel that it was unable to find support. Additionally, substance abuse was a means of coping, so they would consume tobacco or marijuana to escape from the problems at home or finances or divorces. So I really want to say that 2 of the qualitative analyses need to be a bit more highlighted. So in particular, accessibilities and barriers to care. So at a systemic level, we're looking at South Asian representation in health promotion and healthcare professionals was communicated to be in a large absence. So there needs to be more people from the South Asian community in the health workplace. And furthermore, the study demonstrated that barriers of inaccessibility at a systemic level also included things like discrimination or race, and also immigration status. And in addition, healthcare costs can be costly to new immigrants and that are not included in OHIP, such as psychologists. And information on mental health services also needed to be communicated more heavily to youth. So the study was able to determine that when giving these participants 13 mental health services on a piece of paper, and this included services such as Kids Help Phone and Center for Addiction and Mental Health, only 36% of these resources were able to be recognized by most of these participants. And that's just a group of a 10 sample size. So I really wanted to just talk about my strengths and limitations since there are quite a few here. And in terms of the qualitative information provided, there's a lot of in-depth assortment of information about examining barriers and accessibility. But there are also certain pitfalls, like the fact that the small sample size of only 10 people. So we need to have a larger sample size to gather more data. And the larger proportion of study of these participants happen to be women. So we need an equal proportion of sexes. And it's also the stigmatization of mental health is really ingrained within South Asian culture. So it's hard to engage with the youth. And minimal heterogeneity was present between the qualitative information provided. In terms of quantitative information, there's a lot of strengths. The Canadian Community Health Survey, which was utilized to find most of this information, accumulates a lot of different heterogeneity and also a regression breakdown. And multiple avenues were able to determine mental health outcomes, such as self-evaluating, clinicals, and diagnoses. But in terms of limitations, surveys unfortunately are impacted by a term called recall bias. And recall bias impacts accuracy of results because participants are retrieving information about past events. And that difficulty in remembering can impact at a systemic level in terms of results and prevalence rates. So underreporting due to stigmatization of mental illness is also another limitation, which can decrease the amount of prevalence or incidence rates. And there is comparatively small sample size because the community is novel and the data associated with South Asians born in Canada is comparatively small. So in order to provide more research, I think longitudinal studies that measure physiological parameters could be a way to strengthen these limitations. Ultimately, I really want to go home and talk about these two important key findings, which were the gender differences. South Asian female immigrants have a heightened risk of mood disorders in comparison to the males. And this investigation is necessary to be able to find why this is happening. There was a study conducted in 10 countries, this also includes Canada, that says women were associated with an increased rate of major depression in comparison to men. So this shows that this is across multiple countries here. And in terms of the differentiation, we can see that the South Asian immigrant population has a higher prevalence rate in comparison to Canadian-born South Asians. Then again, highlighting how immigration and migration have significant impacts on one's well-being and mental illness. And anxiety disorders tend to be higher in the immigration population. And additionally, this could be possibly due to the immigrant experience, which could experience discrimination, unemployment, barriers due to language, and this increases the prevalence rate. So to end my presentation, I just wanted to say that there are correlations between anxiety and depression and the South Asian population, and the rates seem to be marginally higher than And in addition, their migration has significant impacts on immigrants from the South Asian diaspora in terms of mental illness corresponding to anxiety and mood disorders. And I think there needs to be a lot more research done on the field. So I think a longitudinal study can be used to further research to clarify and track immigrants and their children, and instead of using cross-sectional surveys that have been done. And this allows for the opportunity to monitor progress and cohorts to determine immigrational effects. And additionally, another possible study could be comparing South Asian immigrants to other backgrounds to determine different migrational impacts. And that was my presentation. Thank you for listening.
Thank you so much. That was a great presentation.
I have a question for all of the panelists. So we're talking about discussions and research in mental health or the realm of it. That's a pretty contemporary and upcoming research section. So a lot of the limitations is or are just lack of statistics and studies and experimentals and all of that. But with it, we also see a lot of pseudoscience, misinformation, negative stigmas, or I think misinformation is a huge part of it with the pop culture, trends in self-care and posy vibes only and that kind of a thing. So I'm kind of wondering how each of you feel we could work on overcoming those negative stigmas, misinformation, pseudoscience that hasn't been properly like argued against.
I can answer first if that's okay.
Yeah.
I think it's super important to look at this in two avenues. I think first, I think re-education. I think at a young age, if we start to normalize and like mental health is something most people in the population have like go through, right? So at a young age, if we're taught about it in a normal way, in like a classified way, and built it from the teachers at a young age, when you get older and you feel these emotions or your feelings or your whatever your body's going through, you're okay with it and you're not so destigmatized and you're okay to look for help. And it's so at a young age, I think if we demystify it and destigmatize it, I think that would be a great starter. And I think more avenues and accessibility at a young age as well would also help with this.
Thank you. Those were all very, very good answers.
Yeah, thank you.
So this is for Dhwani. So one of the things that you had said is that part of the limitations to access that South Asian immigrants experience, or one of the possible reasons for it, is that they don't see enough representation in the healthcare themselves. Like there's a lack of South Asian people in the healthcare systems. And I was wondering if you've done any research as to why that is. Like, is it a problem of South Asian people receiving education, or is it a problem of educated people who are South Asian being unable to get jobs in the healthcare, or is it maybe another factor?
I haven't done much research, but I can make my best guess here. And from what I'm theorizing and from what the literature I read, I'm assuming that individuals, when they go into centers, they don't, like, I think as immigrants, they may not have access and be knowledgeable of where individuals of POCs may be. I think if I were to go to certain communities in Canada, there would be a large prevalence of like healthcare professionals in specific communities. For example, I feel like Mississauga, I could mostly see a lot of South Asian representation. But if I were to go somewhere else, I wouldn't be able to have that. So I think it depends on population dynamics, and I think of where individuals immigrate to. And so I think looking at that might be able to evaluate where you can find representation. And I think that would be able to help individuals who have immigrated to maybe be able to converse in their native tongue, you know? So that's what I would, my best guess.
Thank you.